ability. So Dr. Clark Joseph.
Good evening, YouTube. It is me, Mrs. Dave the lawyer. Happy Friday night. Thank you so much for spending your Friday night with me. Today, we are revisiting the video that we watched on Wednesday night about offshore pharmaceuticals. And if you guys were on with me a couple nights ago, I'm still kind of mind blown about what I learned on Wednesday night. That pharmaceutical companies are purchasing generic drugs from labs in China and India. And when they come to the United States, they don't have to independently test for purity or really anything. And that was very shocking for me to hear because I just assumed that it was FDA protocol if you were getting pharmaceuticals from another country when they came here to the US that they were tested to make sure everything was kosher, that it was right. But we learned the other night that no, that's not the standard. They do not have to do any testing. And what has been found is that some of these medications are not pure. And they're causing bad reactions and in some cases even death. So that's what this hearing is addressing. My opinion, I feel like the fix is very easy, that we just need to require testing when things come to the States, but that's just my opinion. But let's get started and we'll chat some more here.
Could independent third-party testing of generic drugs change the financial incentives to prioritize quality among companies operating in the U.S.? And is it possible to scale enough testing to make an impact?
Yes, absolutely, to both questions. The first point as to could it change financial incentives, one of the, I believe that procurement reform of precisely the type included in Representative McCormick and Delora's Transparency and Quality in Pharmaceuticals Act would, by changing, introducing quality metrics and independently derived manufacturing metrics into the military drug procurement, would, first of all, in addition to the direct effects, would have ripple effects throughout the private sector.
So you're saying start with just the military's acquisition, 7%, and then you think doing that, testing that, making that the highest quality would then create more incentives for the rest of the 33%?
Absolutely. Because once there is a kind of gold standard for examining quality and set by the government, ideally codified into law, that will both create a precedent that these other large group purchasers can follow without fear of being a pioneer. Though kudos to Kaiser for their pioneering work in that manner. But perhaps more importantly, this will create at least the specter of potential liability and force, either in a legal sense or liability to their patients who might become aware of things, and force decision makers at the purchasing level to take quality into account.
So create a certification standard, so it can be certified, inspected type thing.
That would be wonderful.
Dr. Thacker, or Dinesh Thacker?
I think that clearly there's a cost involved in testing everything that comes into the country. What we need to understand is what is the consequence of not doing that, because we really don't have good data as to what is the consequence of poor quality medicine in terms of hospitalization, in terms of adverse events. We just don't track that kind of information. So in order to justify what is needed to create a testing program, you always look back and say, well, we've gotten away this far by through doing this. And mostly when patients go to their pharmacist and say, my medicine isn't working, they're usually told that it's a psychosomatic thing. It's all in your head because the drug looks different. Here's the challenge. The challenge is that there is no liability for purchases today. They can determine what goes into formulary. Like, for example, most formularies essentially have manufacturers, 2 or 3 manufacturers, and usually they're located overseas. But as a patient, if I go to my CVS and say, look, if my formulation is yellow or red, I really don't have the ability to influence that because the purchasing decision is made by the formulary at that point in time. Creating a liability at the procurement level that Adam's talking about, that I think at least will change the equation a little bit and incentivize buyers to be able to look at quality as well. Right now, every negotiation is about price. It's not about quality at all.
So you're going to hear me say this a lot during the stream, but shout out to Brian Menser, and he commented, I can't believe this is a question. And I have to agree. I can't believe that this is a question. I can't believe that there is no standardized regulations and testing that is done when these meds come to our shore. They have no way of tracking all of the negative side effects. And again, I'm just like mind blown. How have we allowed this to happen? And also, how come we as the American people didn't know this? Again, I mean, shame on me for just assuming that the FDA, that's supposed to be like this amazing, know-it-all organization, that's supposed to protect the American consumer. Sorry that I assumed that they already had these safeguards and protocols in place, but they don't. And it's kind of idiotic that they're asking these questions in this hearing. I'm really disappointed in our country that this is going on. And I really hate the fact that we're just trying to, well, not us, that Congress just wants to point the finger at China or India or other offshore labs and pharmacies. No, absolutely not. They should not be pointing the finger. They don't even know what's going on. That's a lot of trust to foreign countries. Anything could be in these drugs. I mean, we've been hearing for years that China's trying to kill us. They're trying to poison us. They're putting fentanyl in everything. They're putting fentanyl in our toothpaste. They're putting lead and toxins and everything. Don't buy from China. China's so bad. We've been hearing this probably for over a decade, if not more. And we purchase a lot. If you look into this, we purchase so much of our pharmaceutical products from China. And our government requires zero testing when it comes to our shore. They're just given to pharmacies and they dispense it. And then what this guy was saying is a patient complains that, I took this generic and it's just not working right. I feel weird when I take it, or I have this symptom or that symptom. And they're going to the pharmacist, they're going to their doctor, they're reporting this adverse reaction, and they're telling the patient, oh no, that's psychosomatic. What you're feeling, that can't be true. That's all in your head. There's a problem here, guys.
Thank you, Mr. Chairman.
Thank you, Ranking Member. So, Ms. Solberg, how did you figure out your drug wasn't working?
My drug didn't work in a number of different ways at different points. So the beta blocker, my heart rate didn't come down. The tacrolimus, I found in the morning when I had my coffee, my hand was shaking. And that is a telltale sign of being high dosed on tacrolimus. This one over here is the one that sent it below normal, 3.9, and opened me for rejection. This has no symptoms. You just are open to rejection. So you have to do a lot of blood testing. And I've been through a lot of IVs and a lot of blood draws in my life. I don't have good veins. And at certain points, they're going to have to literally start pumping my fingers for blood to test my levels. And they've had to do that in the past when you couldn't get access to a vein. So I have challenged veins that I have to pay somebody to poke to go test the drugs again. And sometimes it's twice a month to make sure my levels are proper. Now that I'm on name brand, I'm down to my monthly to every other month blood tests.
So on do you have insurance, I guess?
I do have insurance.
So if your generic doesn't work, do you have to pay the higher copay
Yes.
because of brand? even though it doesn't work?
Yep,
And even though you've proved it doesn't work?
yep.
Surprising. That surprises you, doesn't it?
I'm sorry?
Doesn't that surprise you?
Oh, it shocks me, but I'm a patient advocate, and I've watched how the health insurance companies put us in a really bad position, especially those with chronic illness.
Yeah, that doesn't make sense.
Again, we're just pointing the finger. This is what Congress and the Senate likes to do. Let's blame insurance. Not that insurance is great. You know, they do make you jump through hoops to get brands, and you should be able to get what you need. But the problem is that, again, we don't have any protocols. We're just rolling the dice with Americans' health because, you know, we're just greedy and we have to make profits any way we see fit because they just don't care about us. They really don't.
Dr. Clark Joseph, so the argument that some buyers have is they say, oh, it's going to cost more money. Have you ever done an analysis that because when you end up back in the hospital or your condition's not treated, it actually costs more money? Have you ever done an analysis that says that's not actually, even if it costs a little bit more for the American drug, it's still worth it?
Yes, absolutely. I'm actually, both me and my co-founder, David Light, are co-authors on a recent working paper on precisely this issue. We estimated the cost from adverse events associated with low-quality drugs. And I am very happy to follow up with detailed calculations and so on, but we found a number that we feel is very conservative of about $18 billion per year. And the actual cost of testing every batch would be a tiny fraction of that. Generic drugs in the United States, although we do pay significantly more than the rest of the world for our branded drugs, we pay something like 33% less on average for our generic drugs. And we found in our experience with Kaiser and others that testing and certifying every batch would add about 1 to 3% to the cost. So we could still pay more than 30% less than the rest of the world and have a fully certified generic drug supply that would be of high quality.
Okay. Dr. Diamante, you talked about a drug that was recalled.
Yes, the drug was recalled by the FDA, and yet it remained on the market. And one of the pharmacies.
If I have my car is recalled, right? I get a letter sent, right? And they tell me I have to go in and get something done. So that's not the way the FDA works?
Not that I'm aware. First of all, the physicians who prescribe the drug are usually unaware that something has been recalled. The company, one of the, I don't want to name pharmacies, but specific pharmacies, they should know that a drug has been recalled and not sell it to the clients. It seems irresponsible to just get away with it and not, and to enable disease to go forward. And again, it's clearly a pricing issue, or they had it shelved and they want to sell it. So it's a big problem because I think lack of awareness on the client, the physician, and the people who are purchasing it just don't seem to be aware. Hospitals may also be involved in this. They just buy stuff up in large amounts, again, price-driven.
So what kind of contaminants are found in medicines, and what kind of risk do they pose to patients?
Well, certainly nitrosamines are one of the big ones, and the reason I really pay a lot of attention to that is because of their linked to chronic diseases, which are currently pandemic in the world. We have just taking low-dose nitrosamines causes diabetes, obesity, fatty liver disease, and dementia. And you could just name the gang of four that's causing trouble in the United States and all the money we spend on trying to treat these people. Unfortunately, once you have these kinds of diseases that are drug-induced, they're harder to treat. Now, I'll give you a good example. In the 1960s and 70s, the rates of diabetes in people who were between 60 and 70 were far lower than they are today. The cost of treating them today is much higher. So if you look at 60 to 70-year-olds back then to those now, the rates are so much higher, and yet our medicine is supposedly better. What happened?
Mr. Thacker, so when you were a whistleblower, Did the FDA say, thank you, thank God that you're here, and, why don't you come in and show us how we're going to improve this? And then can you brag about all the changes they've made?
I wish it was true. I'm sorry it wasn't.
Oh, it's not true?
I did offer to meet with the FDA. Unfortunately, that never came to pass.
And so they don't care.
I'm sure they must have a good reason for that. I can't comment why. I mean, they wouldn't want to meet with somebody like me who had something to offer.
Okay. Ms. Alberg, what do you hear from, do you have any stories of other patients that have gotten bad quality drugs or ineffective drugs?
Many. Dr. Lever and I meet up on a podcast every couple of weeks, and we were talking about generic drug quality. And about 5 days later, a young man was at that time living up in by Buffalo, New York, and he called and said, "I'm taking myself to the hospital right now." I'm like, "What's going on, hon?" And he's the 28-year-old guy about that. He said, "My beta blocker's not working. My heart rate. I feel like I'm gonna die. I got to go to the hospital." I'm like, "Go get it checked out." And then he got stabilized, looked at the meds, changed the generic. He went back to his old drug, and he was fine again. And that was just like a regular old Tuesday afternoon in the office with somebody calling saying they've got a problem. I have a board member who is on thyroid medication, and she had a battle trying to keep her thyroid levels even on generics, and gave that up decades ago for name brand only because thyroid medications are very specific. I have had many people hospitalized, and Dr. Lever at the Cleveland Clinic was constantly dealing with this, and not only with beta blockers, but the problems back about 2017 or 16, 17, 18 with tacrolimus. We were losing transplant patients, and nobody could figure out why. Why are they dying? They've been stable for 10 years, and then all of a sudden they're in rejection. It's because they got inert drugs. And you know how much it costs to put a heart in a person? It's about $1 million. And this is like $5. Why are we not supporting the amazing work that we're doing with this high expense, high output procedure with a $5 drug?
Dr. Clark-Joseph, why are we testing? I mean, the FDA, I think the Department of War is starting to test now, right?
That's correct.
So why isn't the FDA doing that? I mean, this seems pretty simple.
Well, the FDA is mostly set up from a process perspective in their inspection and examination capacities. So, and that is certainly an important part of the equation. Making sure that the production facilities and production lines are as they're supposed to be is important. However, it doesn't, as we can have seen, it doesn't catch everything. And we are, Valisher, are very much mission aligned with the FDA, but have a complementary set of expertise and capabilities. And I don't have a full explanation beyond that of why the FDA has not gone this route, but we look forward to any productive collaboration we can with them going forward.
So are there examples that you know of in the private sector where, in contrast to the federal government, where with drugs they purchase based on quality first, then price?
So I know we have been running a program with Kaiser for a number of years now, wherein they, in order for manufacturers to enter their bidding process for their next year's procurement, they need to first get their medications tested, and then if they're selected, agree to ongoing certification. So Kaiser is therefore guaranteed, they're still asking them to compete on price, but filtering down to the ones who are highest quality and then let them compete on price.
Dr. De La Monte, the FDA relies heavily on self-attested manufacturing data to meet manufacturing standards. So so do you feel comfortable that somebody has an economic incentive to cut costs and the FDA just relies on their stuff? Does that make any sense to you?
Solely economic incentives are unacceptable. We have to go for quality and patient care and outcomes. We're in a healthcare profession to make people well, not worry. I mean, the small amount of money that's cited for additional testing and third-party qualification seems like we should be willing to pay that amount. You can't get everything for nothing, so, right.
Senator Gillibrand.
Thank you. Dr. Delamonte and Ms. Salberg, in both of your testimonies, you discussed the long-term impacts that low-quality medication has on the health of patients. However, many consumers do not have the background or expertise to discern whether a medication is safe or not. This could potentially lead to...
Okay, but you as the consumer should not have to have that capability. You rely on the FDA to approve these medications, approve these facilities. Why should you have to discern that for yourself? If you have to discern that for yourself, what's the point of buying it through a pharmacy, an FDA regulated pharmacy? What's the point? If you have to discern it yourself, then you should be able to go get your meds off the street and, do the testing yourself. I just don't understand how this is even like a discussion. Listen, I'm all for that. I think, you as a consumer, you should have discernment. You know your body best. And I learned very young in my early 20s that I know myself better than any doctors, and anything that they're prescribing to me or advice or whatever, I can't trust it blindly. I had to learn that the hard way. And I know there's a lot of people out there that have gone through the same thing. But I just don't understand what the point is of having the FDA approve things if they're literally killing people. I thought their whole job was to watch out for us, to make sure that the things that these companies are giving to the public are safe, because they have a safety rating, and they're not supposed to put something out into the country that is considered not safe. So what is the point of them if they're telling consumers, oh yeah, take this drug, it's safe, but it actually really isn't safe, because they don't even require testing or independent testing when the drug comes on shore. There could be anything in your drugs. That's what I'm hearing them say. Let's continue.
To mistrust with all generic drugs. So, Ms. Salberg, as a patient advocate, how should policymakers promote the need for strong oversight and increasing transparency while avoiding panic that could lead patients to stop treatment or delay care if they are financially unable to pay for brand name drugs?
Thank you for that question. I think, number one, we have to be...
I want to share with you guys something else that some people are aware of, but I think a lot of people are not. And that is the fact that the FDA makes over 50% of its funding from Big Pharma. So the statistics are 47% of the FDA's income, what they bring in, what the revenue stream is, 47% comes from taxpayers. 53% of the FDA's revenue and money come from Big Pharma. And when it comes to the drug review division, 70% of the FDA's budget comes from Big Pharma, okay? So what does that mean? You guys think about it. These big pharmaceutical companies are funding the FDA. So don't you think that raises some ethical issues? Because there must be a lot of pressure on them to approve these drugs if these pharmaceutical companies are funding 70% of their review. But that's how Congress set this program up for us, the American people. So I just want everybody to be aware that that is how the FDA is funded. But let's continue.
Honest. We have to tell the American people the honest truth, and we can start today by having the FDA update their website because it tells you generics are the same.
Right.
That's a lie. We can't lie to the American people. We have to tell them the truth.
That is a lie. We talked about this Wednesday night. Generic drugs are not the same as brands. They don't have to be. They're not required to be. Only a certain percentage of ingredients have to be identical or similar for it to be a generic. And I'll look up what the actual percentage is, but if the FDA is putting on their website that generics are the same as brand, that is just completely false. Completely false. And we talked about this too on Wednesday night. The way that a pharmaceutical rep explained it to me is even if all of the ingredients were the same, think about it like you're watching Martha Stewart bake a cake. And Martha Stewart lists out all the ingredients that she's putting in, and you follow Martha Stewart's recipe and you make that same cake. Your cake is never going to turn out the same as Martha Stewart's because you're not Martha Stewart. It may be very similar, but it's never going to be identical. And that's how generics versus brand was described to me. But if this is true, and I haven't been on the FDA website recently, if this is true and they're making statements that generics are identical or the same as brands, that is just a bold-faced lie. And that needs to be taken down immediately because that's not fair.
The good news is 70+% of generic drugs are great quality and they work very well. And we should lean into enforcing good actors to be prominent. And we should also tell people if they are taking a medication that they have taken for a chronic illness for a long period of time and they notice they're feeling different, to immediately communicate with their physician.
Make that a red flag. Do you have you worked with the AARP to get them to notice that on their website, so like as a trusted source of information?
So the HCMA is much smaller than the AARP, and they have not listened to my advice thus far, so maybe this might change that, and I hope that they would do that. But I would just really love if you guys could get the FDA to actually tell the truth on their website. That would be lovely.
We will work on that. Dr. De La Monte, can you expand on the potential public health consequences if patients lose confidence in FDA-approved medicines and begin avoiding or discontinuing medically necessary therapies based on incomplete or misunderstood information? And how should we increase doctor and patient education on this issue?
First, I think there's a relatively low awareness in general among physicians about side effects that are specifically due to the drugs.
Yep.
That's a big problem in medical education, where we just assume that the drug will work. We think because it was FDA approved, it's FDA approved by the generics, and I think that's a misunderstanding. Second, I like the idea of third-party testing and then having a validation of color codes so they know this has been third-party tested. I actually contacted a supplement company that I use, and I said, by the way, how do I know this is not poison? And they actually showed me all their third-party testing and validation. I said, oh, so it's out there, and you could actually tell people. I like the idea of having a website, but there's so much on the web, so you need to have a way for,
Trusted.
I mean, right now, people are using AI for medicine. I mean, you may as well just dial it in, whatever it is. You would think that some of those complications of a specific generic from company X is problematic and shouldn't be prescribed. I mean, eventually we have to drill down to physicians and healthcare workers telling people that we're going to keep to the safe ones. And I think that is the way to go. There are safe ones. People are not dying every second, but they have these complications. And I think because they're not dying every second, we just keep dismissing the ones that are bad. So we need to come up with the good group and tell people that there, in fact, are bad groups.
Yeah, agreed. It'd be great to have a clearinghouse of information on an FDA-approved website to actually track production and manufacturers that have bad
I agree.
track records,
Right.
I would think. Dr. Clark-Joseph, Valisure is a leader in independent chemical testing for carcinogens and toxic impurities in generic drug manufacturing, filling a critical transparency gap in the global pharmaceutical supply chain. You've partnered with the Department of Defense on pharmaceutical quality assurance assessment study to chemically test score generic medications. How has this collaboration informed your ability to scale, standardize for a model for large purchasers, and how can we use it to reward safe manufacturers? And along with that, when various pharmacy chains offer their own generics, do they have better quality assurance because they themselves become brand names, like CVS or Walgreens?
Let me start with, and go in reverse order.
Yep.
So with respect to large pharmacies such as you mentioned, CVS or Walgreens having their own brand, my impression is that they are still sourcing them procuring
way.
them in exactly the same way, and that they do not yet have any additional internal or independent quality verification or certification built in. As to our project with the Uniformed Service University for the military, it has led to fleshing out a operational version of this red, yellow, green scoring system, which has been guided by an expert review panel, and we have further put in the kind of details to do this. And we've gotten an excellent snapshot of the risk or quality risk profile of the extant manufacturers of the top essential medicines, which also overlap with kind of high-use medicines in general. That said, we also know that through our work with Kaiser Permanente that this absolutely can be done at scale. The kind of snapshots
We know this can be done at scale because they require American 503B pharmacies to do this. They have to do this. And most of them have independent testing also. And I mean, again, it's just like so mind-blowing that this is even a discussion. Of course they can do it at scale. But, big pharma and pharmacies, they need every single penny. They don't want to spend anything additional unless they're forced to do it. And they don't care that somebody has a bad reaction because that doesn't affect them. They'll probably get even more prescriptions out of it if somebody has a bad reaction because their doctor probably prescribed them more. But it's affecting the patient. It's affecting insurance companies. I'm not sure why they're not requiring this. But I don't know. Let's continue. And then I want to share with you guys what I learned also about generics.
that we've been generating for the Uniformed Service University ideally would both be updated on a regular basis because manufacturers can, change their procedures, things turn over, and also perhaps pave the way for batch testing in kind of the Kaiser model at nationwide. This, not to sound like a broken record, but this is again why we are really, really excited and urge your support for the Transparency and Quality in Pharmaceuticals Act.
Yeah, it makes sense.
Okay, so I want to share this with you guys because this is very important, and I didn't know this either. So when people hear the term generic is the same as brand, they often assume that every ingredient is identical, but that is not true. What is true is that the active ingredient has to be the same. So generic drugs have the same active ingredients as brands. But, and this is a big but, the overall formulation can be quite different because inactive ingredients can sometimes make up 70 to 99% of the tablet's weight. Let me say that again. Inactive ingredients sometimes make up 70 to 99% of the tablet's weight. That's a little concerning. Here's what else. So for example, a 5 milligram tablet may weigh 100 to 300 milligrams total. The actual drug might only be 5 milligrams, with the remainder consisting of fillers, binders, coatings, lubricants, disintegrants, colorants, and preservatives. So some of the common inactive ingredients include lactose, microcrystalline cellulose, cornstarch, pregelinitized starch, magnesium stearate, silicon dioxide talc, PEG, which is polyethylene glycol, titanium dioxide, and various dyes. And some inactive ingredients can cause problems in susceptible individuals, but we're learning that it can cause a lot of issues. So lactose, for example, is a common filler. It can cause bloating, gas, diarrhea in lactose intolerant patients. And also, guys, like when you get your prescription, and I may be wrong about this, but I'm pretty sure it doesn't list all the inactive ingredients. Maybe it does. I'm not sure if it does, though. But the other thing that it could have, dyes, yellow 5, red 40, which we've talked about on this stream before. You know, red 40 is a toxic dye that, thanks to RFK, is going to be eliminated from our food, but we know that red 40 is linked to cancer. Blue 1 and other various dyes, but the problem with the dyes is that they can cause allergic reactions, and a lot of people actually report headaches or sensitivities to various dyes. PEG, polyethylene glycol, is usually well tolerated, but there have been rare reactions that have been documented. Cornstarch has the potential, anybody with corn sensitivities could have a bad reaction to cornstarch. Magnesium stearate is frequently blamed online, but generally considered safe at pharmaceutical doses. There's not strong evidence of toxicity in the medication levels. Sodium-containing drugs can sometimes, affect people that are on low sodium diets. And then other preservatives like benzyl alcohol, parabens, sulfites, they can cause reactions in people. A lot of people notice the difference between brand and generic in thyroid medication, anti-seizure medication, that's a little scary. Psychiatric medication, that's very scary. And any type of extended release formulations. So in these cases, the active ingredient is identical, but differences in the release mechanisms and the other fillers and binders affect how the drug feels for people. So an example of this is levothyroxine. Small differences in absorption can be clinically important, which is why many endocrinologists prefer patients stay on the same manufacturer. So to summarize what I just said, generics must have the same active ingredients as the brand, okay? So 100% of the active ingredient must be identical. But the inactive ingredients, so the binders, the fillers, sometimes 99% of the actual pill can be substantially different than the brand. So there can be a lot of reactions, and it doesn't sound like these generic manufacturers are doing the same type of studies that the brands have done. So, the brand, they have run sometimes years or even decades of studies to prove that the drug, the active ingredient, is effective, and they make the drug very standardized. So anytime you're getting a brand drug, it's always going to be the same. But nobody's, to my understanding, has done studies on when you take that active ingredient and put all kinds of different fillers in it, how that's going to change how that affects people. And this is the problem that we're having. And it's very misleading that our own FDA, our physicians, our pharmacies, etc., are telling people that generics are the same as brand, because that's just completely untrue. Again, up to 99% of the actual pill or capsule could be completely different than the brand. But let's continue.
It's because you could incentivize not only drug pharmaceuticals chains to do it, you could incentivize hospital networks to do it, like with Kaiser Permanente. the DoD to do it. So you can find the large purchasers or even group purchasing organizations to do it, to mandate that they have to have the high quality and testing done, and then they certify it to say we've been tested. So my assumption is if you create these large groups doing it, it'll create a standard, and then people will all be asking for that standard.
Yes.
And it'll also raise awareness.
Now, let's just ask for the standard now. Who do we need to talk to? Who do we need to lobby? Who do we need to call? Do we all need to call Rick Scott's office on Monday? This is something that us as the American people needs to be standard. I know I've said this a million times, but I'm mind blown that this is not standardized. It's really angering because the reality is we're giving pharmaceutical drugs to our senior population, and as we learned at the beginning of this hearing, some seniors take 5, 15, 20 drugs a day. And the fillers and the crap that they're getting offshore may be causing horrible diseases. And then instead of trying to get to the root of the problem, they're just prescribed another medication. So their quality of life is severely diminished. But we also give pharmaceutical drugs to our children, to babies. And we actually have no idea what we're giving them. No idea. And there's no standard of what we need to do once those meds reach our shore. They are not tested whatsoever. So we're just relying on these offshore labs to do the right thing, to be ethical, to follow our standard. But we actually have no idea if they're doing that or not. And if you caught the first part of this hearing, we also learned that when we go in to supervise or audit these facilities, we give them sometimes like 12 weeks in advance to let them know, hey, we're coming on this date. So they have time to clean everything up and make it look like they're doing everything right. But there's a good chance that they're not doing it that way. They're cutting corners and we have no idea. Whereas in America, to my understanding, somebody can go in and audit a pharmacy without a lot of notice. I don't even know if they need to give any notice, but I know that it's not 12 weeks. They don't have 12 weeks to get their act together.
Awareness that you can pay for a higher level quality of drug, and that everyone should have that choice to pay for a higher quality level of drug.
Absolutely. And two important points are that, we really believe that beginning with military appropriation reform will start that ripple effect, and exactly as you
And then the elite
described.
hospital networks will be next. And then from there, I think the most successful pharmaceutical chains will be next. I mean, CVS is going to want to certify that their drugs are their medicines that they're putting on their label are tested.
Absolutely. And one point, although yes, there is some minimal additional cost to testing, it's important to note that we didn't find a correlation between price and quality in these drugs. So it's not like group purchasers would be forced that the greens are the most expensive ones. There's actually a paper that I think it was Kevin Schulman and someone else not too long ago who looked at the impact of the recalls of the angiotensin 2 receptor blockers that were recalled because they were contaminated with nitrosamines. He compared the price and volumes for those to the angiostatin something or other, the ACE drugs that serve a similar purpose but weren't recalled.
Yeah.
And he found that despite the recalls of these objectively bad batches, the price did not increase, the price of the ARBs did not increase relative to the control, and the volume, if anything, is slightly increased.
And even if they did slightly, people would be happy to pay it. So if you just look at a generic of Zyrtec and then you look at Zyrtec, the generic is, let's say it's a $10 dosage bottle. The generic might be $6. There's $4 in there you can play with. So if it has to be 7 instead of 6, you're still offering a lower price, but you're guaranteeing the quality.
Absolutely.
So there's a huge difference in price. Like, so if you're price sensitive, you're buying the generics generally. There's still room between the brand and versus the generic to add a little more value.
Absolutely.
So,
100%.
Mr. Chairman, I've asked all.
So I also want to inform you guys, because I wasn't sure about this earlier, but when you pick up a generic medication from your pharmacy, you do not get the list of inactive ingredients. The pharmacy has that list, and maybe you could request it, but that is not automatically given to you. So most of us have no idea what kind of inactive ingredients make up 99% of our medication. And to be honest, we actually don't know if 100% of the active ingredients are identical to the brand. We have no idea because we don't do any testing once these meds come to our shore. So if you're taking generics, you really don't know what you're taking. Or let me say that. If you're taking a generic that comes from India, China, or any other offshore country, you have no idea what you're actually taking. Your doctor has no idea what you're taking. Your pharmacist has no idea what you're taking, because there's no testing that's being done once it comes on shore. So we're really gambling here, guys. And I bet a lot of you are like me. And if you're watching this, you're just learning right now that this is a thing, that we have no idea what we're taking. Not a clue. Not a clue. And how many of our congressmen, senators, presidents have preached to us about, being afraid of offshore countries, and all these countries want to hurt Americans and they're trying to infiltrate America. And how many recalls have there been on dog food and toothpaste and other, different products that we buy from China and other countries? And they could be putting anything into our drugs. And we have no idea because our FDA just doesn't feel compelled to have a standard of testing. They just don't want to do it. They don't care. And of course, the insurance companies and the pharmaceutical companies, they're not going to do it unless they're required to. Why would they spend the extra money to do that? Maybe if they're an ethical company, they would want to do that. But I don't know a lot of big pharmaceutical companies that I would refer to as ethical. If you guys know any, please drop it in the chat.
My questions, and I have to go pick up my son.
Okay. Go pick up
Thank you
your
all. I have a child arriving at an airport, but thank you all for your testimony today. I'm very grateful.
Probably. Thank you, Ranking Member Gillibrand. Dr. Clark Joseph, have any insurance companies or anybody listened to you that you could save them money by at all? Has anybody?
It has been we have pitched it a number of times. That was earlier on in our trajectory. At the time, we didn't have well-established data. It was just, hey, it seems entirely rational that this would save you money in the long term. We hope that with the accretion of more and more data that is in some ways becoming overwhelming, pointing to the actual economic health costs of these things, that insurance companies and health systems will be much more interested.
Can you show me that Medicare would save money?
I would have to follow up with you for detailed analysis, but I think it is overwhelmingly likely that Medicare would ultimately save a lot of money.
Okay. Well, whenever you're ready, I can organize a meeting for you with CMS to do that.
I would be delighted. Thank you.
So right now, you guys know the risks. So how do you pick your drugs? Because So you've got some pill bottles there, right? So does it say where you got it?
So I brought these 3 because this is the one that was underdosing me. This is the one that was overdosing me. And this one came in the middle, but it's a generic. And then I went to name brand, and I'm not risking it anymore.
So you know where those all came from?
Where did they come from? No, I didn't know. This one is an interesting one. You'll like this. It's Sandoz. I'm from Jersey. They used to be down the street. I figured it was a local. It's made in India.
How'd you find that out?
Because I have smart friends who help me research. And I'm a patient advocate who
Oh,
has
it's
more
not-
resources.
It's not on the bottle, is it?
No. It's not on
You
the
know
bottle.
that your clothing all has country of origin.
My clothing does,
It
my
makes you feel
shoes do,
good?
everything, yeah.
Yeah, and that makes you feel good.
Yeah, you don't know where it's coming from. You don't know who made it. There's another component here that I do want to bring up, and that is temperature. When these drugs are imported, we don't know that they're temperature controlled, and we don't know what with
No,
tacrolimus.
they're not.
What's that?
No, you know they're not temperature.
We know they're not temperature regulated, yes.
Yeah, that's what you
And they
know
can
for
get
sure.
very hot,
Yeah.
and that's not safe either.
How about the rest of you? And if you know, I guess you know. Do you? So are you pretty good about everything you or your family might take, or your friends?
I try.
Important friend to have.
I like to think so. I try very hard, but even sometimes it's just something I worry about and have very little control over. In spite of my connections with Valisure and so on, I'm still ultimately forced to use basically the same pharmacies that everyone else is. If the ones in town have made what strike me as
I mean, let's be real though. Nobody's forced to do anything. We live in America. We always have a choice. Now, sometimes the choice may not be what you want it to be. Maybe you have to use a pharmacy that's out of network. Maybe you have to buy a brand drug and your insurance doesn't cover it fully or at all. So then the choice would be you're paying cash for a better quality product. But that's a choice. Nobody's forcing you to use a certain pharmacy. Insurance isn't forcing you. You pay your premiums, you choose that insurance policy, and they give you guidelines and they'll reimburse you or they'll cover things if you utilize their protocols. But it's not like anybody's holding a gun to your head. Like, you do have a choice. And for some people, they're going to spend whatever they need to spend to be healthy and to feel great. That is the choice that they make. And whether that means spending thousands of dollars on longevity meds, brand drugs, concierge doctors, that's the choice that some Americans do make because they want to feel good, they want to be healthy, and they don't want an insurance company dictating to them what they can and cannot do. But for some Americans that, maybe are retired or on a fixed income, then they would follow those protocols because they haven't figured out a way to bring in more income to cover a brand drug or something else. But still in all, it's still a choice. Your body, your wallet, your life. In America, you do have the freedom to choose. So I don't like the misleading, I'm forced to do this. No, nobody's forcing him. This is a choice that he's making.
poor purchasing decisions that month. Like with duloxetine, I take duloxetine. It has been a lifesaver for me. But there's a whole thing with drug-specific nitrosamines in duloxetine, and that had me very worried because, yeah.
Anybody else?
Thank you.
Dr. DiLamonte, do you know where your drugs come from?
So I wonder.
Art, you should know this stuff, right? But it's impossible, isn't it?
It's really tough. And
Yeah.
the thing is, somebody has to have skin in the game to get this to work. And, I've asked people I know who are in the higher levels of making drugs whether they could actually make their own generics, or whether they would supervise the generics because they're the source of the compound. And they all claim it's impossible. I think they just want to push it aside and not do it.
Have to, so then why do it, right?
Right, there's just extra work. But I think the push can come from consumers. And if this concept were somehow popularized and made aware, you get a lot of pushback from people who are angry that this is what's happening. And,
Guys, we got to do something. We got to do something. I don't know what yet, but I'm going to think of something, because we as consumers, we can make a fuss, we can put pressure on these companies, on the FDA. This needs to be fixed, don't you guys think?
there are some people out there who are on TV and the like who might be interested in sharing the information and making people aware. And, they're so good at drama. Showing the outrageous component of what we're getting and realizing that, things could be fixed. Sometimes you need a lot of pressure from people who are actually the victims, especially the senior citizens who have a lot of political
That's how
clout.
government's supposed to work, right?
Well, it's supposed to, but if people don't know, if it's a secret, if you're getting food that comes from wherever, you could at least read the label. Now you can read the label, but medicines, we don't know.
Senator Gillibrand and I have a bill, the Clear Labels Act, so it'll have country of origin for the ingredients and manufacturing. So that's a start. We're also working on mapping where all the ingredients come from. So I think, the federal government's got unbelievable buying power. I used to run the largest hospital company. I can tell you what, I was only 2% of the healthcare dollar, but I could buy on volume, so I could direct the market, right? Federal government can do the same thing if they want to do it. But, they'll say, oh, gosh, it's going to cost us more money or blah, blah, blah. It doesn't really matter. If you're dead, it doesn't really help you much. So we're going to get this done. So thank each of you for being here. I think this was a great hearing. Problems with drug quality are affecting the American people, especially older Americans whose health relies on these medications. No American should have to wonder if the drug they are taking is safe or contains the medicine they need to stay healthy. I'm going to continue to work with all my colleagues to support policies that bring safe and high-quality drugs to patients. I look forward to continuing to work with my members on this committee. If any senators have additional questions for the witnesses or statements to be added, their hearing record will be open until next Wednesday at 5 p.m. I want to thank each of you for being here.
All right, guys. Well, I really appreciate everybody that came here tonight and streamed with me. Trying to get to, I'm going to get to 500K followers this summer. That is my short-term goal for this channel. So I really need everyone's help. If you're watching and you haven't subscribed to Mrs. Dave the Lawyer, please hit that subscribe button. And if you already are a subscriber, and some of you have been with me and Dave from the beginning, the inception of this channel a couple years ago, share these videos, share these streams, tell all your friends and family about it. We need to get to 500K. That's the short-term goal. And then after that, 1 million and beyond. But as a community, we can make a difference. There is over 480,000 subscribers on this channel, and we can make a difference together. If you guys have time this week, I would urge you to call your senator's office or call or email Rick Scott's office. Let him know that you watched this hearing on my channel and that you share with me the same shock and I don't even know what word to put it, but we need this to change. We need our Senate to do something about this immediately. They must require independent testing to all generic medications that are coming to us from China, India, or any other country offshore. This is a must. This has to be done. So please, I'm urging you guys, please take the time next week to call Rick Scott's office or call your local senator. But if we, as a community, put the pressure on and let them know that this is something that concerns us, because it affects every American, that's when real change can happen. If you do that, please come back to this video, comment what you did, who you spoke to. Let's all get on this together. Again, thank you so much for joining me tonight. I really appreciate this community, and I will be back probably tomorrow. We'll do a little streaming tomorrow. And also, too, because this channel has changed over the last couple months, and we'll discuss that over the weekend as well. But I want to hear from you guys what other topics that you're interested in. Now, for the last couple of years, Dave primarily focused on the House Oversight Committee and the Judiciary Committee, because those were, two areas that he was very interested in. And as you guys know, like, those streams were amazing, and the congressmen and the senators that were featured on the streams and the shorts and the videos, I mean, freaking epic. Senator Kennedy, Josh Hawley, I mean, these guys are the goats. But I want to hear from you guys. What areas, what committees, what topics are you guys interested in? Me personally, my background is psychology, health, and fitness. So as you probably noticed, I'm going to be streaming anything that has to do with insurance, Medicaid, Medicare, pharmaceuticals, health, wellness related. So we're going to see a lot more stuff like we did tonight. But again, I am open to streaming whatever you guys are interested in. So leave some feedback. I want to make sure that this community is happy. And again, thank you so much for joining me tonight, and I hope everybody has a wonderful weekend.